Hello friends, welcome back to the Aphasia Education series. In this video, we are going to talk about a condition of aphasia which is rare but can significantly impact the quality of life of a person. This condition is called as conduction aphasia. So let's understand this conduction aphasia in detail. Friends, conduction aphasia is relatively a rare type of fluent aphasia. It primarily affects the person's ability to repeat the spoken language. Even though their understanding is good, their fluency is good. But when it comes to repetition of certain words, that's where they face challenge. It's often considered as a disconnection syndrome, because it occurs due to disruption in the communication pathway between two key brain areas, which are communication and language areas. So what are the parts of brain that is being affected in conduction aphasia? Well, the first area that is affected in conduction aphasia is arcuate fasciculus. This is an area in the brain which is responsible for connecting Broca's and Wernicke's area. This is basically a bundle of nerve fibers that connects these two areas. When there is damage or impairment in this particular region, that's where you will see conduction aphasia often. This damage will affect the continuation between two major language areas of the brain, which will lead to difficulty in understanding the language, which means that the Wernicke's areas, which is responsible for giving meaning to the words that you have heard, and Broca's area, which is production area where the sound is being produced. There is a disconnect between these two areas. That's why the transfer of information is disrupted and repetition fails. Some of the common symptoms when it comes to conduction aphasia are: number one, impaired repetition. A person will find it very difficult to repeat words or phrases correctly. For example, if a person hears, "Yesterday was a rainy day," then his response will be something like this: "Yes, rain, yesterday rain. What did you say?" He or she will make phonetic paraphrases, which means speech will contain sound-based errors, such as switching sounds in words. For example, saying babble instead of table, or saying bubble instead of trouble. The third thing will be the speech will be fluent but self-corrective in nature. The person will be able to make full sentences, but he will notice his or her own mistakes and will often try to fix them but will find it unsuccessful. They will often pause, correct themselves, which will significantly impact the flow of speech. The comprehension is the fourth thing that will be affected. Even though it's the least to be affected, but certain areas you will be observing some of the changes. For example, they will follow the conversation well, but while repeating the same thing just to give a response, that's where they will observe that they will struggle. And the last area that will be affected will be in the reading and writing part. The reading comprehension would be usually preserved, but remembering what they read and repeating them could be a problem sometimes, because repetition is involved here. When it comes to writing, there could be some grammatical errors or spelling errors that will be observed, especially when it comes to repetition of similar sounds. When it comes to naming, they might have naming difficulty. They might forget what to name certain words or misname them. And last but not the least is the awareness part. They are usually aware of their own mistakes, and that leads to frustration, causing limitation in their self-esteem and giving them some mental health challenges. So, what causes this kind of aphasia? Well, this kind of aphasia is not just involved in stroke, but it's commonly seen in people with traumatic brain injury, brain tumors, and neurodegenerative disease. So, how the diagnosis of this condition happen? Well, diagnosis is possible with the right assessment methodology. Here, a speech-language therapist is the key role player. A speech-language pathologist will do certain tests which incorporate tests like assessment of repetition of task, assessment of naming and retrieval skills, assessment of naming and retrieval task, comprehension and conversation analysis. When these things are tested, then the speech-language therapist would be able to identify the gaps and the challenges of the patient and would be able to create a customized rehabilitation protocol for him or her. So, what's the treatment here? Well, speech-language therapy is the key treatment method over here. But at the same time, some important exercises helps the patient to improve. These exercises are the full body exercises which improves the overall mood and well-being of an individual. Behavior therapy or cognitive behavior therapy, to be specific, helps individual to improve his self-esteem and self-awareness. Along with that, doing speech language therapy where key focus is on improving repetition skills, enhancing communication strategies, and using compensatory techniques are the key here. So, how does the patient shows improvement with these therapies? Well, the prognosis of the treatment varies depending on individual to individual. However, some people will significantly improve from this condition who show a positive motivation and a positive approach towards recovery. Caregiver as well play a very critical role in the entire rehabilitation process. Communication is a very frustrating challenge for any patient, and more supportive the environment is for the patient, the better outcomes that we can expect. That's why having the right strategy, having the right kind of therapist, and having the right mindset for a patient at the same time caregiver is the critical ingredient to success when it comes to recovery from conduction aphasia. When there is not enough support, if the therapy is not done in a very inclusive or holistic manner, that's where there are challenges in showing good results. So in summary, conduction aphasia is majorly about difficulty in repetition of words. Fluency is intact, understanding is as well intact. The patient will mostly be fluent while communicating, but will make a lot of phonetic errors and will do self-corrections. Comprehension is preserved in these patients. Well, they find difficulty in communication because of lack of self-esteem and self-understanding. If the empathy around the people is less, then this situation can get further more challenging. When it comes to what areas of the brain that is being affected, it's the connecting loop between Broca's areas and Wernicke's area is affected in this particular condition. Since the awareness of the error is too high, the patient can easily get frustrated, and that's why therapy not only should be limited to speech language therapy but should incorporate other therapies like cognitive behavior therapy, physiotherapy to improve the overall physical ability of an individual, at the same time speech therapy to work on strong communication skill set. Treatment, as mentioned, is a strategic one, and the more multimodal it is, the better it would be. That's why we recommend you to reach out to us, because at HealthQ Rehab, we create a multimodal approach when it comes to rehabilitation from aphasia. Our online programs are designed in such a way that incorporate strategic protocols which includes speech language therapy, physiotherapy based facial and chest exercises, at the same time cognitive behavior therapy with nutrition guidance, so that patient can get best outcome from their aphasia challenge. If you are someone who is suffering from aphasia or your loved one is suffering from aphasia, feel free to reach out to us and let us understand and help you further with the aphasia challenge. On that note, I'll end this video here and I'll see you in another video. Thank you.